Welcome to Catalyst Medical Review. Today we'll be talking about intussusception. Let's define it. Intussusception is a condition in which one portion of the bowel telescopes into another portion of the bowel. The most common location is the ileocecal valve, where the ileum telescopes into the cecum. As a result, both arterial and venous circulations are affected, leading to ischemia, infarction, perforation, necrosis, and edema. Intussusception is the most common cause of intestinal obstruction in children younger than 2 years of age. The etiology. In most cases of intussusception, there is no identifiable cause. However, in cases where causes have been identified, the following have been implicated. Number 1, Meckel's diverticulum. Number 2, polyps. Number 3, lymphoma. Number 4, hypertrophied Peyer's patches, which is actually secondary to viral or bacterial infection. And number 5, foreign body. How does it present? These patients present with irritability, colicky pain, and vomiting. This might be interrupted by a period of calmness. This cyclic pattern normally continues until the patient is taken to the emergency department for assessment. In infants, irritability is usually inconsolable. Rectal bleed occurs in about 80% of patients, and oftentimes when the stool is mixed with bright red blood and mucus, it is described as currant jelly. Vomiting is usually a late manifestation. In very small children, that is below 2 years old, sweating, pallor, and vomiting are the main symptoms. The physical exam. Normally, a tubular mass is usually palpable in about 80% of patients in the right lower quadrant. There may also be a feeling of emptiness in the right lower quadrant. This is known as Dan's sign. How is it diagnosed? Barrier minimum is the diagnostic study of choice, as it is both diagnostic and therapeutic for intussusception. It usually shows the coiled spring appearance of the bowel. Plain abdominal radiograph may show less gas in the right lower quadrant or an air fluid level suggesting obstruction. Ultrasound is another imaging modality that is very useful in showing the obstruction. Overall, basic labs should also be ordered. The treatment. Reduction with barrier minima with air is successful in 75% of cases if performed within the first 48 hours. This should not be performed if there are peritoneal signs. When reduction by barrier minima is unsuccessful or contraindicated, then direct reduction by laparotomy should be performed. Complications. If the diagnosis is missed, then vascular obstruction will lead to ischemia, infarction, gangrene, and perforation with a high mortality rate. The differential diagnosis. The child comes in with right lower quadrant pain. The following should also be considered: appendicitis, volvulus, viral gastroenteritis, bacterial enterocolitis, incarcerated hernia, and Meckel diverticulum with torsion. The disposition of these patients with intussusception should be admission to the hospital. Well, as always, I do hope that this short presentation refreshed your mind regarding intussusception and has prepared you for your upcoming exam. Thanks for listening, and I wish you well.